pronounced what's called benign essential tremor. And in this disorder, what you'll see is that often at rest, there is no tremor. So with the hand just sitting here, there is little, if any, hand movement. It will become more pronounced with activity. So you'll see a little bit if you reach out to touch my finger, and just touch it, and bring it back. You'll see a little bit of activity and a little bit of the tremor. Now, if I ask to perform an activity, like pouring water into a glass and then raising it up, let's see what happens. Okay, you can see how pronounced the tremor becomes with activity. And if you try to raise the glass up, okay, and you can put it down. So it's quite pronounced. This is not subtle. Other causes of tremor, one common cause that people worry about, Parkinson's disease, for example, often the tremor will extinguish with activity, and there will be a more pronounced resting tremor. In addition, there will be the other features of Parkinsonism, the bradykinesia, the cogwheeling with movement of joints, which is not present in this case.
Go ahead.
Okay. Just another way of demonstrating the degree of tremor that happens with activity in this benign essential tremor would be to ask someone to write something. Try to write your name, or anyone's name.
I sometimes have to brace one hand with the other to do this.
That's great. You can see how pronounced the tremor is and how difficult then to make out the script. If you didn't know the name, I would say it's unintelligible. I will mention that the tremors of this type often respond very well to medication. And what's used most commonly are beta-blocking agents or primidone. In this case, I've asked the patient purposely not to take his beta blocker prior to this demonstration. Normally, his tremor is still present, but it is nowhere near as perceptible. And that's a function, again, of the underlying disorder and not taking the medication.